Welcome to the Canadian Beef Cattle Podcast, presented by the Beef Cattle Research Council, the most popular content from beefresearch.ca, available on the go. Before we get into this week's episode, a quick message from the BCRC.
With newborn calves comes risk for disease and dehydration. Having the skills to quickly identify dehydration and knowing methods for early intervention can have a meaningful reduction in the rate of calf illness and death on your farm. To assist producers in assessing calf dehydration, BCRC has developed a dehydration checklist as part of the CAF 911 resources. This printable resource effectively reviews the signs to look for and provides guidance on where to find more information. Access this resource and more by clicking the link in the show notes. This episode is titled Responsible Antibiotic Use on Canadian Cow-Calf Operations and features the BCRC Science Director, Dr. Reynold Bergen.
Hi there, I'm Reynold. This Research on the Record article originally appeared in the February 2025 issue of Canadian Cattleman magazine, and it's now been reposted on the beefresearch.ca site with the publisher's permission. Today we're going to talk about responsible antibiotic use on Canadian cow-calf operations. So back in 2018, over-the-counter antibiotic sales ended at Canadian farm supply stores. And so that means that after that, producers needed to have a veterinary-client-patient relationship with their veterinarian before any antibiotic could be prescribed or sold. And that regulation was designed to ensure that the right antibiotic is used for the right animals at the right dose and at the right time. Now, Dr. Cheryl Waldner and some of her colleagues from the Western College of Veterinary Medicine did a study to see how or whether that has changed producer practices. And the online version of this article links to a couple of their published research papers if you want to delve into the details. So what did they do? They surveyed 168 Canadian producers in the cow-calf surveillance network in 2020. And so that was a year after the regulation came into full effect. So these participants were asked about what antibiotics they used to treat different types of cattle and how the regulatory changes had affected their operations. About 2/3 of the survey responses came from Western Canada and the other third from Eastern Canada. And because some of those Western producers had also participated in an earlier version of the surveillance network, their antibiotic use records could be compared over time to see how things had changed. Well, they learned that nearly all cow-calf producers use antibiotics, but they don't use them often. So nationwide, 95% of producers used antibiotics in their cows and calves, but less than 10% of them treated more than 5% of their cows, and only 12% of them treated more than 5% of their calves. So again, nearly all cow-calf producers use antibiotics, but they don't use them very often. Now, antibiotics were mainly used to treat lameness in cows, diarrhea in newborn calves, and bovine respiratory disease, or BRD. Overall, treatment rates for all three diseases in Western Canada were very similar in 2020 compared to 2014, but fewer producers were treating calves for BRD in 2020 than in 2014. And maybe the regulations had something to do with that decrease, but it's more likely due to things like vaccination and calving conditions and forage quality, things like that. Now, about 3/4 of producers said they hadn't changed, their access to antibiotics hadn't changed. About 20% said they were harder to come by, and about 2% said they were easier to come by. 2/3 of producers said that antibiotic costs had not changed. A few of them said costs had gone down, and about 1/3 said that prices had gone up. Now, those who felt that antibiotics had gotten more expensive also included the producers who tended to treat more of their calves before weaning. Now, nearly all producers said that their antibiotic use practices had not changed since the regulations had changed. Only 4% said they were using less, and only 1% said they were using more. Nearly everyone said the veterinarian was their main source of information about antibiotics and appropriate antibiotic use. But what has changed is the types of antibiotics that are being used. There's a category of antibiotics called macrolides, and there's really 4 different macrolide antibiotics that are used on cow-calf operations. The first one is Micatil, which is also called Hymatil or Tilcomed. The second one is Draxin, which is also called a lot of different things. It's called Increxa and Lidax and Macrocin and Rexolide and Tulavin and Tulinovet and Tulicin. The third one is Zactran, and the last one is Zuprevo. So those are all the macrolides. If those names are familiar, you might be using them. Now, macrolides are also used widely to prevent and to treat bovine respiratory disease in the feedlot. Now, these antibiotics have always been prescription only. They were never available over the counter. Now, in 2020, over half of Canadian cow-calf producers in the survey reported that they used macrolides. Now, remember, going back to the start, hardly anyone's used treating a lot of animals, but people do use these things. In the West, the proportion of producers using macrolides had increased from less than half in 2014 to 60% in 2020. This was mostly to treat lameness in cows and BRD in calves before they were weaned. Now, although the use of this macrolide has increased, it still isn't the first choice for producers. Tetracyclines like biomycin and liquamycin are still the go-to treatment for lame cows by about a 3-to-1 margin. And when it came to treating pre-weaned calves for BRD, there's another drug called florfenicol. So that's things like Fenicil and Florchem and Nuflor and Resflor and Zeleris. And that was used over macrolides by about a 2-to-1 margin. Now, these macrolides have become more popular for a few reasons. One is that the requirement to obtain antibiotics from a veterinarian means that producers are now receiving solid advice about what product is the most appropriate for any given situation. Another factor is that I listed all those complicated names of the macrolides. A lot of those are generics, and there's now so many of these generic macrolides around that they've become more affordable and cost-effective. And finally, macrolides generally require a smaller dose, and so they work a lot better with things like dart guns and crossbows and pole syringes. Now, they also asked about what do you do if the first drug treatment failed? And in that case, producers were more likely to consult with their veterinarian than to try a different antibiotic if it was a case of BRD or diarrhea. But if it was lameness, they were more likely to try a different antibiotic than to call a veterinarian if the first treatment failed. The bottom line is that an ounce of prevention is still worth more than a pound of cure. Good nutrition and an appropriate vaccination program won't completely prevent all disease, but they will reduce the number of animals that need antibiotics. So what does this mean to you? Well, it's a good time to review your herd vaccination and herd health programs with your veterinarian. New oral and intranasal vaccines are around. They can be given at birth to help protect against scours and BRD. And remember, the BRD still needs a booster at spring processing. There's no effective vaccine available for any form of lameness, but foot rot will respond well to antibiotics. If you treat lameness with an antibiotic and it doesn't help, don't just switch to another antibiotic because it's probably not foot rot. Just switching to a different antibiotic throws good money after bad, and the cause may not be infectious, in which case you don't need antibiotics. So that's where you take advantage of your veterinary-client-patient relationship. Ask your veterinarian what you're dealing with and how to treat it effectively. Thanks for listening. I'll talk to you again next time.
Thank you for listening to this week's episode. You can find all relevant links and information at beefresearch.ca or in the show notes. The Beef Cattle Research Council is funded by the Canadian Beef Cattle Checkoff and strives for excellence in the production of Canadian beef, cattle, and forage through research, innovation, and extension. Tune in every Tuesday as the Canadian Beef Cattle Podcast delivers straightforward insights, expert information, and a wealth of practical knowledge for Canadian beef producers. Subscribe now.